I'm Dr. Karim Kurji, the York Region's Medical Officer of Health. Thank you very much for coming and joining us here this afternoon. We have been saying for a long time now that it was only a matter of time before York Region would see its first case of COVID-19. The case that we have presents a number of complexities. The confirmed case is a travel-related and comes as a result of travel from Iran on Tuesday, February 25th, with a layover in Denmark. The individual, a woman in her 30s, developed symptoms on February 25th prior to her return and was symptomatic on the flights. On Wednesday, February 26th, at approximately 3:55 p.m., the individual subsequently boarded Go Bus 40 at Pearson International Airport, Terminal 1, traveling eastbound, sitting in the upper deck with a final destination off and arriving at the Richmond Hill Center terminal. On Thursday, February 27th, the individual was tested and assessed at Mackenzie Health Hospital in the City of Richmond Hill. The individual is currently in self-isolation, recovering at home. As a result of the coordinated and collective efforts of our healthcare and public health system, the individual was quickly recognized, assessed, and isolated. All those individuals who traveled in the business class sections of Qatar Airways flights QR 483 or 163, Air Canada flight AC 883, or Go Bus 40 traveling eastbound and sitting on the upper deck may have been exposed to this positive case of COVID-19. And we are asking them to contact York Region Public Health at 1-800-361-5653. And we've extended our hours to 8 p.m. for this weekend. Otherwise, it's usually up to 4:30 p.m. Now, I would take a moment perhaps just to explain some of these exposures in greater depth. So there have been a number of areas where exposures could potentially have happened. And I will start out first with a plane. There have been 3 flights that the individual was on. And having had symptoms whilst on the plane means that this individual was infectious. Now, generally speaking, what we normally do is we try and identify individuals who may have been seated in 2 rows ahead and 2 rows behind and on the sides, and we contact those individuals to take specific precautions, and usually we put them in self-isolation. The reason we do this is because they were contacts of a case. As for other individuals on the flight, in the business section, we would usually ask them just to monitor for symptoms and signs for 14 days. The normal protocol is we would ask for a flight manifest. However, we have to realize that these exposures have occurred on the 26th and 27th of February. And normally, the coronavirus that we're dealing with tends to manifest itself in terms of symptoms and signs within about 5 or 6 days. So the window of opportunity for us to ensure that these individuals know about their exposure and have isolated themselves should symptoms develop is rather short. And this is why we are asking for the media's assistance to help us get the message across. Eventually, we will be getting the flight manifest, and we've requested this, and we will be able to contact the specific individuals that we are particularly concerned about. Having said all this, I have to emphasize that often when we do this sort of contact tracing, the individuals that we find usually do not develop symptoms. And you may recollect with the first case in Toronto, we certainly were involved in following up about 15 of the 37 individuals in the business class, and none of them developed any symptoms. So we are hoping that none of these individuals develop symptoms, but it is a process that we follow based on past experiences. Now, I'd like to also explain the risk level in the GO bus. We consider the risk level to be much lower than in a plane. There is more ventilation, the period of travel is much less in time, and there may have been individuals who have been boarding and off-boarding the bus, so the exposures may have been limited in time as well. We would like, though, for these individuals to get in touch with us so we can help them understand the risks, explain to them the symptoms and signs, and if there were some unusual circumstances, then we may be able to act appropriately. Normally, we would ask that these individuals monitor their own symptoms and signs for 14 days. So if they were to develop fever, cough, or shortness of breath, we ask that they isolate themselves and they get in touch with a healthcare provider and call us. And when they get in touch with the healthcare provider, they should really phone in advance. So those are the main requests that we have with respect to following up on these contacts. Let me explain that we believe in aggressive contact follow-up. And this is the strategy that we use with respect to containing the spread of COVID-19. It is a strategy that worked in SARS, and we have every confidence that we would be able to contain the exposures. We have been through almost 200 persons under investigation by today in York Region, and we must have isolated close to 600 individuals. But we are very fortunate that the laboratory system today has a great turnaround time, and we are able to reassure individuals, because so far we haven't had any positive individuals, this being our first one. That being said, it is not unusual for us to possibly get additional cases in the coming days and weeks. The comforting thing is that all of these cases can be linked to travel abroad, and we are not seeing any cases pop up in the community that have no linkages at all, such as the ones that you may have heard about in the news in Germany and the United States. So we honestly believe that there is no virus circulating in the community as yet, and with the broadened criteria with respect to the case definitions, whereby individuals from a variety of countries are tested if they have symptoms, it will increase our comfort level if we find that there aren't as many that are coming forward. What we are seeing just now is an increase in the numbers of cases from Iran. Right? Having said all this, I think I will pause here, and I'll be very happy to take any questions and to try and explain our approaches further or to clarify any points further. Thank you.
Dr. Beatrice from CP24, you mentioned this individual took 3 flights in particular. Can you tell me about the route? I understand Iran to Denmark, Denmark to Toronto. What was that 3rd flight?
So it was actually 2 flights in outside Canada. So they originated at Imam Khomeini Airport in Tehran, and then this was flight QR483 to Hamad International Airport, and this was on the 25th of February. And then she took a flight from Hamad International Airport on the 25th to Copenhagen Kastrup Airport. That's on the 25th again, and she had a layover in Denmark. Now, the layover in Denmark may pose certain risks, and our system works in a in a way whereby we inform the Public Health Agency of Canada, who then will inform the Danish authorities, and they will do the appropriate follow-up in Denmark. And from Copenhagen Airport on the 26th of February, she took Air Canada 883 and landed at Lester Pearson Airport at around 2020, right? On Wednesday, February 26th. So it's these 3 flights.
So it was Iran to Qatar, Qatar to Denmark, Denmark.
That's correct. That's correct.
Question about the GO bus. How long could COVID-19 live on surfaces that could exist in this bus? Are people that may have gotten on that bus, let's say from Richmond Hill Centre back to Pearson later that day, also at risk from contracting COVID-19 based on the fact that individual was there on the upper deck and may have touched handles or things like that?
So the way that the COVID-19 virus spreads is, we believe it's mainly through droplets. So if the individual were to cough or sneeze without necessarily covering their cough, right, we could expect the virus to possibly go to as far as about 2 meters away from the individual and would usually land on surfaces. Now, there is a little bit of controversy as to how long it actually lasts there. I mean, there are some reports that say that it can last as long as 9 days, but the majority of people feel that it may be much shorter than that. So theoretically, it is possible for somebody to touch those surfaces, and if they were then to touch the mucous membranes, be it in the eyes, the nose, or the mouth, they're likely to be able to get the virus. This is why the public health messaging that you see so often is so important. We need to make sure that we have washed our hands frequently, and we're not touching our eyes, nose, or mouth with unwashed hands. So that is very important. Contact management is built on risk assessments. There's never 100% risk-free way. And what we do is we try and assess the risks with respect to getting the particular virus, and accordingly we determine what the action should be.
You said you isolated 600 individuals?
Yes, those 600 individuals refer to individuals in the last couple of months, right, who before the test results were available. So let me just explain. Every time we suspect an individual might have COVID-19, what public health does is they usually, after interviewing the individual, ensuring the individual is undergoing the tests, and we arrange those tests through the hospitals, we then actually ensure that they're self-isolated until the test results come back. We also follow up on their contacts, and if appropriate, we would self-isolate the contacts as well, where necessary. Now, self-isolation actually is quite a major process for them because they're supposed to not share bathrooms, they're supposed to be in a room by themselves. If they have to interact with family members, they're supposed to keep at least 2 meters apart and wear a mask, right? They shouldn't be sharing any utensils. So we would really like to remove them from self-isolation as soon as possible. And as soon as the results come back negative, unless they fall into certain categories where they have to be monitored for 14 days, we can usually lift the self-isolation. Now, this is a very resource-intensive process, right? It usually takes investigators about 5 hours to interview a given client, and then we have to interview the contacts. But this is a process that we use in order to put a ring around the suspect cases and put a ring around their contacts, so that if they were to turn positive, we would have already eliminated any chance of any exposure to the community, right? That having been said, that approach works well for those individuals who don't have very many exposures. But it doesn't work so well when you have so many exposures, because when you have so many exposures, then we've got to jump in very quickly, and time is of the essence, and we have to aggressively identify the contacts and try and put rings around the contacts before they develop any symptoms. Right? because once they've developed symptoms, they may have already infected other individuals, and so that makes the process more complicated. But by doing that aggressively, we would be able to contain the virus.
Lines again, please, and the flight numbers.
Sure. The flight numbers, by the way, we have it in the media release, right, as well. So the flight numbers are Qatar Airways flights QR483 and 163, and these flew on February the 25th. And then you have Air Canada flight AC883, which was on the 26th of February. And we are really after those individuals who would have been in the business class sections, right? In particular, for all of them, right? We don't consider individuals in the other sections to be at risk.
This individual was wearing a mask during her travels?
No, she wasn't. And that is likely to, we believe, possibly increase the risk somewhat. She was also not traveling alone. She was traveling with her husband and a toddler.
And have they been placed in self-isolation as well for monitoring?
Yes, they have been isolated as well. And the husband has undergone his tests already, and we are awaiting those particular results. Both of them are well. The husband had some symptoms that could have been attributed to shoveling snow recently. But on the other hand, COVID-19 also presents itself with myalgia. So we thought it best to get him tested. And we probably will get a toddler tested in due course. You can imagine how challenging it is, really, for the family when you actually have a toddler who can't see their mom, right? So it's a challenging circumstance.
Are you quite frankly surprised, Dr., that it's taken this long to get the first positive case in your region?
Yes, I am. We have a community that has a lot of ties with many parts of the world. And I think one of the great things about our community is that they seem to be quite health conscious, and they are quite diligent with respect to taking measures to avoid any exposures to society. I haven't seen anything like that with respect to all those 170, 200 individuals that we investigated. They have been extremely good. Most of the individuals, if they come at the airport, they get a private vehicle and they come straight home. They make sure they have no exposures with anybody else in society. And in some cases, in this particular instance, they seem to have acted correctly after they got home. I guess the exposure was in the go bus, which really we would prefer that folks with symptoms do not take public transit, right?
Your region is certainly home to probably one of the biggest both Iranian communities and Chinese communities in the entire country. Are you kind of bracing yourself for the possibility of more cases because of so much travel between your region and these regions that are most affected by COVID-19?
So once again, you see, in the beginning, of course, the focus was on travel from China. And whilst we expected probably to see the first case in Canada here, and there were indeed a number of people that I was quite concerned about, that didn't pan out, you know. And I can only attribute that to the health consciousness of the folks that we have here in York Region. I think they're very health conscious. We seem to have about 10% of the Iranian community in Canada in Richmond Hill. And I think the Iranian situation is one that was recognized rather late. So that may account for people now showing up with symptoms. This particular individual was exposed to a mother-in-law, I believe, you know, who had some cold symptoms. Now, you know, maybe they didn't think very much about it, because remember, it's only recently that Iran has started having its COVID-19 cases. So, you know, the recognition of it would take a little while, you know, before folks might seriously consider that their cold symptoms might actually be COVID-19.
Sorry if you already said this, but have you already reached out to people on those 3 planes, or are you waiting for them to contact you?
No, we haven't been able to because we don't have a flight manifest as yet. The normal process is, because we work as a system, we work very closely with the Ministry of Health, and we work closely with the Public Health Ontario. We have requested the flight manifest, and they have been requesting this through the Public Health Agency of Canada, which normally then gets in touch with the airlines, and we would then be getting the flight manifest. However, past experience with getting flight manifests has revealed there are often delays in getting the flight manifest, and often the flight manifest doesn't have the correct contact phone numbers. We may find this surprising, but if we have to try and find contact phone numbers, it wastes that much more time, right? So we felt that it was probably in the best interest of the public that we request your assistance with respect to getting the message across. So anyone who is traveling those particular flights can call us. And we are particularly concerned about the business class travelers. And then we will take them through a risk assessment and determine what the next steps would be. Thank you very much indeed. If there are no questions, and if you certainly wish to ask me any questions separately, I'm more than happy to take those. Thanks again.